Yes, come in.
Hello,
Hello. Are you Elizabeth Lee?
I'm Elizabeth Jaeyoung Lee.
Okay, so why did you come here today?
I came here because I feel very weird. Like, I have irregular heartbeats.
Do you kind of feel dizzy sometimes?
Yeah,
Maybe sometimes like lightheadedness, or
yeah,
when you exercise, do you kind of feel tired?
yeah.
I think you might have a disease called atrial fibrillation.
Oh, what is that?
It's a type of a disorder called cardiac arrhythmia, which is a disorder of the heart rate. So your heart rate either beats too fast, too slow, or irregularly. And as you said, you kind of felt an irregular heartbeat.
Yeah.
So I think you have atrial fibrillation, which usually has definitely has an irregular heartbeat, but also usually a really fast heartbeat. Do you kind of feel a fast heartbeat sometimes?
Yes, because it's irregular. It's like dun, 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 dun.
Okay. So, anyways, I'll explain kind of more about what atrial fibrillation is. Uh, so, it is caused because SA node, which is a part of the heart, has it is a natural regulator of the beating of the heart because it gives electrical impulses that causes the heart to beat. And since this is irregular, your heartbeat itself is irregular, and it's related to your symptoms of kind of dizziness and lightheadedness because it shows that you're not getting enough oxygen to the body, and this is caused by irregular heartbeat, which means that your red blood cells are not going to your bodies regularly and not efficiently.
Also, that's bad.
It's really bad. You might even get a stroke, but it's unlikely because it's usually for people who are really old.
I'm not old
Yeah,
yet.
you're not old yet, so you don't really have to worry too much about that.
That's great.
So I'll assign you a medicine called beta blocker.
Well, what is that? What does it do?
It's kind of to slow your irregular heartbeat and kind of cure your atrial fibrillation, and it's going to help you a lot because when statistics have proved that when people are given medications, the people with atrial fibrillation, their chances of having a really like severe outcome is really reduced. So yeah, you don't have to worry that much. Okay. Thank you.
Thank you. I'll see you again sometime.
Okay.
Bye.
Bye. Cardiac arrhythmia or atrial fibrillation is related to what we studied in cardiovascular or respiratory system because as I talked about the SA node in our discussion with my patient, we actually have learned about the SA node and its electrical control of the heart by having the electrical impulses passing through the AV node and its bundle branches, which we learned in the first PowerPoint of the cardiovascular lesson. So, yep, that's how it's related to what we have learned.